Hello, nursing students. Welcome to Nursing Exam Preparation, your ultimate resource for excelling in nursing exams with confidence. In today's video, we'll take you through 150 multiple-choice questions and MCQs on mental health nursing, each designed to challenge your knowledge and enhance your understanding of this vital field. Each question is followed by a detailed explanation, helping you not only choose the right answer, but also understand the reasoning behind it. Whether you're just beginning your studies or gearing up for an upcoming exam, this video is packed with content to sharpen your skills, boost your critical thinking, and reinforce key mental health nursing concepts. Make sure to like this video, share it with your classmates, and subscribe to Nursing Exam Preparation for more valuable resources. Don't forget to hit the bell icon so you never miss an update on our latest videos, all crafted to help you succeed. After you finish the video, let us know your score in the comments below. We'd love to hear how you did. Let's get started and work together to master mental health nursing and achieve exam success. 1. A 35-year-old patient is diagnosed with major depressive disorder. Which of the following is a hallmark symptom of depression? A. Increased energy. B. Elevated mood. C. Excessive worry. D. Feelings of hopelessness. Answer: D. Feelings of hopelessness. Rationale: depression is characterized by persistent feelings of sadness, hopelessness, and loss of interest. Elevated mood or excessive worry are more characteristic of conditions like mania or anxiety, respectively. Increased energy is often not associated with depression, which typically presents with fatigue. 2. A nurse is assessing a patient with schizophrenia. Which of the following symptoms is considered a positive symptom of schizophrenia? A. Affective flattening. B. Delusions. C. Avolition. D. Anhedonia. Answer: B. Delusions. Rationale: positive symptoms of schizophrenia include hallucinations, delusions, and disorganized thinking. Affective flattening, avolition, and anhedonia are negative symptoms, which reflect a decrease in the ability to function. 3. Which medication class is commonly used to treat generalized anxiety disorder, GAD? A. Antidepressants. B. Antipsychotics. C. Benzodiazepines. D. Antihistamines. Answer: C. Benzodiazepines. Rationale: benzodiazepines are frequently prescribed to manage acute anxiety symptoms, while antidepressants may also be used for long-term treatment. Antipsychotics and antihistamines are not commonly used for GAD. 4. The nurse is conducting a mental status exam. Which of the following assessments is important for evaluating the patient's thought process? A. Orientation to time and place. B. Memory assessment. C. Speech pattern and logic. D. Body posture. Answer: C. Speech pattern and logic. Rationale: thought process is assessed by examining the patient's speech pattern, coherence, and logical flow of ideas. Orientation and memory are important for assessing cognitive function, but they do not assess the thought process directly. 5. Which is a common side effect of selective serotonin reuptake inhibitors, SSRIs? A. Dry mouth. B. Weight gain. C. Increased libido.
D. Nausea.
Answer: D. Nausea. Rationale: SSRIs commonly cause gastrointestinal symptoms like nausea, especially when starting treatment. Dry mouth, weight gain, and increased libido are not typical side effects of SSRIs. 6. A nurse is caring for a patient in an acute manic episode. Which intervention should the nurse prioritize? A. Encourage the patient to express emotions freely. B. Provide a quiet, structured environment. C. Allow the patient to engage in group activities. D. Set firm limits on behaviors. Answer: B. Provide a quiet, structured environment. Rationale: a structured and calm environment helps prevent overstimulation and ensures the patient's safety during a manic episode. Encouraging emotional expression may escalate symptoms, while group activities may lead to inappropriate behavior. Setting limits is important, but structure is the primary concern. 7. A 45-year-old patient has been prescribed lithium for bipolar disorder. Which lab test should the nurse monitor to prevent toxicity? A. Complete blood count. B. Serum creatinine. C. Serum sodium levels. D. Serum lithium levels. Answer: D. Serum lithium levels. Rationale: lithium toxicity is a significant risk, so serum lithium levels must be closely monitored. Complete blood count and serum creatinine are not directly related to lithium toxicity, and serum sodium levels may be affected, but are not the primary monitoring parameter. 8. In treating a patient with obsessive-compulsive disorder, OCD, which of the following is the most effective long-term therapy option? A. Cognitive behavioral therapy, CBT. B. Electroconvulsive therapy, ECT. C. Psychoanalysis. D. Antidepressant medication. Answer: A. Cognitive behavioral therapy, CBT. Rationale: CBT, particularly exposure and response prevention, is considered the most effective long-term treatment for OCD. ECT and psychoanalysis are not typically used for OCD, and antidepressants can help but are generally combined with CBT for maximum effect. 9. The nurse is caring for a patient who is exhibiting signs of severe anxiety. Which intervention should the nurse implement first? A. Encourage the patient to breathe slowly. B. Provide a quiet and private space. C. Offer medications as ordered. D. Ask the patient to describe their fears. Answer: B. Provide a quiet and private space. Rationale: creating a calm, quiet environment helps to decrease external stimuli and reduce anxiety. Slow breathing and offering medications can be helpful, but first, reducing the sensory overload by providing privacy and quiet is most important. Asking the patient to describe their fears can increase anxiety. 10. A patient diagnosed with post-traumatic stress disorder, PTSD, is experiencing flashbacks. What is the priority nursing intervention? A. Encourage the patient to discuss the trauma. B. Redirect the patient's focus to a safe activity. C. Administer a benzodiazepine as ordered. D. Ask the patient to confront the trauma. Answer: B. Redirect the patient's focus to a safe activity. Rationale: the priority is to help the patient disengage from the flashback by redirecting their focus to a safe and calm activity. Encouraging trauma discussion or confronting the trauma may escalate symptoms, and medications are secondary in this immediate intervention. 11. A nurse is caring for a patient with a history of panic attacks. Which symptom would most likely indicate a panic attack? A. Slow, steady breathing. B. Feeling of impending doom. C. Increased need for sleep. D. Difficulty concentrating. Answer: B. Feeling of impending doom. Rationale: panic attacks are often characterized by a sudden feeling of impending doom or fear, along with physical symptoms like rapid heartbeat and shortness of breath. Slow breathing, increased sleep, and difficulty concentrating are not typical symptoms of a panic attack. 12. Which neurotransmitter is most commonly associated with the pathophysiology of depression? A. Dopamine. B. Serotonin. C. GABA. D. Norepinephrine. Answer: B. Serotonin. Rationale: decreased serotonin levels are commonly associated with depression, though dopamine and norepinephrine also play roles. GABA is primarily involved in inhibitory neurotransmission and is not directly linked to depression. 13. A patient with major depressive disorder is prescribed a tricyclic antidepressant, TCA. Which side effect is most commonly associated with this drug class? A. Increased appetite. B. Orthostatic hypotension. C. Insomnia. D. Sexual dysfunction. Answer: B. Orthostatic hypotension. Rationale: tricyclic antidepressants commonly cause orthostatic hypotension due to their anticholinergic effects. Increased appetite, insomnia, and sexual dysfunction are more commonly associated with other antidepressants. 14. A nurse is teaching a patient about the importance of adhering to their prescribed regimen of selective serotonin reuptake inhibitors, SSRIs. Which of the following is important to emphasize? A. Abruptly stopping the medication is safe. B. The medication may take several weeks to show effects. C. Only the morning dose is important. D. It is important to take the medication only when feeling depressed. Answer: B. The medication may take several weeks to show effects. Rationale. SSRIs may take several weeks to have a noticeable effect. Abruptly stopping the medication can lead to withdrawal symptoms, and taking it only when feeling depressed may not provide consistent therapeutic effects. 15. A 55-year-old patient has been prescribed haloperidol for schizophrenia. What is an important side effect of this medication? A. Weight loss. B. Extrapyramidal symptoms, EPS. C. Insomnia. D. Increased appetite. Answer. B. Extrapyramidal symptoms, EPS. Rationale. Haloperidol, a first-generation antipsychotic, is known to cause extrapyramidal symptoms such as tremors and rigidity. Weight loss and appetite changes are not commonly associated, and insomnia is not a typical side effect of this medication. 16. A nurse is caring for a patient with bipolar disorder who is on lithium therapy. Which of the following signs would indicate lithium toxicity? A. Increased urination and thirst. B. Weight gain and fatigue. C. Nausea, vomiting, and tremors. D. Elevated blood pressure. Answer. C. Nausea, vomiting, and tremors. Rationale. Lithium toxicity typically presents with symptoms such as nausea, vomiting, tremors, and confusion. Increased urination and thirst are common side effects, but are not indicative of toxicity. Weight gain and fatigue may occur but are not signs of toxicity, and elevated blood pressure is not commonly associated. 17. Which of the following is a common treatment for generalized anxiety disorder, GAD? A. Antipsychotic medications. B. Cognitive behavioral therapy, CBT. C. Electroconvulsive therapy, ECT. D. Benzodiazepines only. Answer. B. Cognitive behavioral therapy, CBT. Rationale. Cognitive behavioral therapy, CBT, is considered a first-line treatment for GAD. Antipsychotic medications, ECT, and benzodiazepines may be used in specific cases, but CBT is the most common and effective long-term treatment. 18. The nurse is assessing a patient with a history of schizophrenia. Which symptom would most likely indicate a relapse? A. Reduced appetite. B. Increased social interaction. C. Increased delusions and hallucinations. D. Improved concentration. Answer. C. Increased delusions and hallucinations. Rationale. Delusions and hallucinations are positive symptoms of schizophrenia that typically worsen during a relapse. Reduced appetite, increased social interaction, and improved concentration are not typical signs of relapse in schizophrenia. 19. A patient with post-traumatic stress disorder, PTSD, reports having frequent flashbacks. Which intervention is most appropriate? A. Encourage the patient to avoid reminders of the trauma. B. Offer relaxation techniques and grounding exercises. C. Suggest the patient discuss the trauma in detail. D. Encourage the patient to stay busy and distracted. Answer. B. Offer relaxation techniques and grounding exercises. Rationale. Grounding techniques and relaxation exercises are helpful in managing flashbacks and reducing anxiety. Avoiding reminders may increase avoidance behaviors, and discussing the trauma in detail should be done with caution, as it can be distressing. Staying distracted does not address the trauma directly. 20. Which of the following is a common symptom of anxiety disorders? A. Lack of appetite. B. Feeling tense or on edge. C. Decreased heart rate. D. Excessive sleepiness. Answer. B. Feeling tense or on edge. Rationale. Feeling tense or on edge is a hallmark symptom of anxiety. Lack of appetite and excessive sleepiness are more commonly seen in depression, and decreased heart rate is not typically associated with anxiety. 21. A patient with major depressive disorder has a history of suicidal ideation. Which intervention is the nurse's priority? A. Encourage the patient to express their feelings. B. Assess the patient's risk for suicide. C. Offer medications to improve mood. D. Redirect the patient's attention to a pleasant activity. Answer. B. Assess the patient's risk for suicide. Rationale. Assessing the risk of suicide is the priority when caring for a patient with suicidal ideation. Encouraging expression, offering medications, and redirecting attention are important, but they do not take precedence over suicide risk assessment. 22. A patient diagnosed with bipolar disorder is experiencing a depressive episode. Which of the following interventions is appropriate? A. Encourage high-energy activities. B. Set realistic goals and provide structured activities. C. Allow the patient to isolate themselves. D. Promote long periods of rest and inactivity. Answer: B. Set realistic goals and provide structured activities. Rationale: during a depressive episode, it is important to provide structure and set achievable goals. Encouraging high-energy activities may be overwhelming, and isolation or inactivity may worsen depressive symptoms. 23. A nurse is caring for a patient prescribed an SSRI for generalized anxiety disorder. Which of the following side effects should the nurse monitor for? A. Hypotension. B. Increased appetite. C. Sexual dysfunction. D. Tachycardia. Answer: C. Sexual dysfunction. Rationale: sexual dysfunction is a common side effect of SSRIs. Hypotension, increased appetite, and tachycardia are not typically associated with SSRIs. 24. A nurse is caring for a patient who is experiencing an acute manic episode. Which of the following interventions would be most beneficial? A. Encourage the patient to participate in group therapy. B. Provide a calm, quiet environment with minimal stimulation. C. Allow the patient to choose activities freely. D. Set firm boundaries and allow the patient to make decisions independently. Answer: B. Provide a calm, quiet environment with minimal stimulation. Rationale: providing a calm, quiet environment with minimal stimulation helps manage agitation and reduce risk in manic episodes. Group therapy, free activity choices, and excessive autonomy can increase stress and exacerbate symptoms. 25. Which of the following best describes a key feature of borderline personality disorder, BPD? A. Fear of abandonment. B. Excessive social withdrawal. C. Lack of empathy for others. D. Chronic mood swings. Answer: A. Fear of abandonment. Rationale: a key feature of BPD is intense fear of abandonment, often leading to unstable relationships. Excessive social withdrawal, lack of empathy, and chronic mood swings may occur, but they are not as central to the diagnosis as fear of abandonment. 26. A patient with obsessive-compulsive disorder, OCD, is beginning exposure therapy. What should the nurse prioritize during this treatment? A. Allow the patient to gradually face feared situations. B. Encourage the patient to avoid all situations that cause anxiety. C. Provide reassurance that everything will be fine. D. Guide the patient to focus on external distractions. Answer: A. Allow the patient to gradually face feared situations. Rationale: gradual exposure to feared situations is a key component of CBT for OCD. Avoiding situations, providing excessive reassurance, or focusing on distractions do not help reduce the anxiety associated with OCD. 27. Which medication is commonly prescribed to treat attention deficit/hyperactivity disorder, ADHD? A. Lithium. B. Methylphenidate. C. Fluoxetine. D. Haloperidol. Answer: B. Methylphenidate. Rationale: methylphenidate is a stimulant medication commonly used to treat ADHD. Lithium, fluoxetine, and haloperidol are used for other psychiatric conditions. 28. A nurse is conducting a mental status exam on a patient. Which of the following is an important area to assess when evaluating the patient's appearance? A. Speech coherence. B. Affect and mood. C. Grooming and hygiene. D. Memory and orientation. Answer: C. Grooming and hygiene. Rationale: assessing grooming and hygiene provides insight into the patient's ability to care for themselves, which can indicate their mental state. Speech coherence, mood, and memory are also important, but are assessed under different components of the exam. 29. Which of the following is a characteristic of psychotic disorders? A. Lack of reality testing. B. Excessive worry. C. Persistent sadness. D. Compulsive behavior. Answer: A. Lack of reality testing. Rationale: psychotic disorders are characterized by a lack of reality testing, leading to symptoms such as delusions and hallucinations. Excessive worry, persistent sadness, and compulsive behavior are not characteristic of psychosis. 30. Which therapy is most appropriate for a patient with severe depression who has not responded to antidepressant medications? A. Cognitive behavioral therapy, CBT. B. Electroconvulsive therapy, ECT. C. Supportive psychotherapy. D. Psychoanalysis. Answer: B. Electroconvulsive therapy, ECT. Rationale: ECT is often used for severe depression that does not respond to medications. CBT and psychotherapy are helpful but may not be effective in severe cases, and psychoanalysis is typically not used in acute depressive episodes. 31. A nurse is caring for a patient who is being treated for schizophrenia with an atypical antipsychotic. Which of the following side effects is most common with this drug class? A. Hyperglycemia. B. Weight loss. C. Dry mouth. D. Extrapyramidal symptoms. Answer: A. Hyperglycemia. Rationale: atypical antipsychotics are more likely to cause metabolic side effects such as hyperglycemia and weight gain. Dry mouth and extrapyramidal symptoms are more commonly associated with typical antipsychotics. 32. Which of the following is an effective first-line treatment for patients with obsessive-compulsive disorder, OCD? A. Antipsychotic medications. B. Cognitive behavioral therapy, CBT. C. Electroconvulsive therapy, ECT. D. Anti-anxiety medications. Answer: B. Cognitive behavioral therapy, CBT. Rationale: CBT, especially exposure and response prevention, is considered the most effective first-line treatment for OCD. Antipsychotics and ECT are not first-line treatments, and anti-anxiety medications are generally not used as primary therapy. 33. A patient with bipolar disorder is experiencing a manic episode. Which of the following interventions is the priority? A. Provide a structured and calm environment. B. Encourage the patient to express feelings. C. Offer group therapy sessions. D. Set limits on the patient's behavior. Answer: A. Provide a structured and calm environment. Rationale: a structured and calm environment helps manage the patient's symptoms and prevent overstimulation during a manic episode. Encouraging emotional expression and offering group therapy may not be appropriate, and setting limits is important but not the priority in this phase. 34. Which of the following is the most appropriate intervention for a patient with acute alcohol withdrawal? A. Provide high-protein snacks. B. Administer benzodiazepines as ordered. C. Encourage hydration with caffeine. D. Restrict all medications. Answer: B. Administer benzodiazepines as ordered. Rationale: benzodiazepines are used to manage acute alcohol withdrawal symptoms, including seizures and agitation. High-protein snacks, caffeine, and restricting medications are not appropriate treatments for alcohol withdrawal. 35. A nurse is caring for a patient with schizophrenia. Which of the following is the most important intervention when the patient is exhibiting paranoid behavior? A. Encourage the patient to socialize. B. Remain calm and non-threatening. C. Confront the patient's delusions. D. Offer food and drink. Answer: B. Remain calm and non-threatening. Rationale: when dealing with paranoid behavior, it is important to remain calm and non-threatening to reduce the patient's anxiety and fear. Encouraging socialization or confronting delusions may escalate paranoia, and offering food and drink does not directly address the behavior. 36. A patient diagnosed with major depressive disorder is at risk for suicide. Which of the following should the nurse prioritize? A. Assess the patient's risk for suicide. B. Encourage the patient to express feelings. C. Redirect the patient's attention to positive activities. D. Offer reassurance that things will improve. Answer: A. Assess the patient's risk for suicide. Rationale: the priority for a patient at risk for suicide is to assess their suicidal ideation and risk. Encouraging expression, redirecting attention, or offering reassurance are important, but come after assessing the patient's safety. 37. Which of the following is a hallmark symptom of generalized anxiety disorder, GAD? A. Delusions. B. Intrusive thoughts. C. Excessive worry. D. Social withdrawal. Answer: C. Excessive worry. Rationale: excessive and uncontrollable worry is the hallmark symptom of GAD. Delusions are associated with psychotic disorders. Intrusive thoughts are more commonly associated with OCD, and social withdrawal may be seen in several mental health conditions, but is not specific to GAD. 38. A nurse is caring for a patient diagnosed with post-traumatic stress disorder, PTSD. What is an appropriate nursing intervention to help manage the patient's symptoms? A. Encourage the patient to avoid talking about the trauma. B. Offer validation and support for their feelings. C. Encourage isolation to avoid triggers. D. Encourage the patient to suppress their emotions. Answer: B. Offer validation and support for their feelings. Rationale: providing validation and support helps the patient feel understood and safe. Avoiding the trauma or suppressing emotions may prevent the patient from processing their feelings, and isolation may worsen symptoms of PTSD. 39. A patient with depression is prescribed a selective serotonin reuptake inhibitor, SSRI. Which of the following side effects should the nurse monitor? A. Sedation. B. Weight loss. C. Sexual dysfunction. D. Increased appetite. Answer: C. Sexual dysfunction. Rationale: sexual dysfunction, including decreased libido, is a common side effect of SSRIs. Sedation, weight loss, and increased appetite are more commonly associated with other types of medications. 40. Which of the following is a common symptom of a panic attack? A. Slow, deliberate breathing. B. Excessive worry about the future. C. Chest pain and shortness of breath. D. Increased interest in activities. Answer: C. Chest pain and shortness of breath. Rationale: panic attacks often present with chest pain, shortness of breath, rapid heart rate, and a sense of impending doom. Slow breathing and excessive worry are more indicative of anxiety, and increased interest in activities is not typical of a panic attack. 41. A nurse is educating a patient who has been prescribed a benzodiazepine for anxiety. Which of the following should be included in the teaching? A. The medication can be taken on an as-needed basis only. B. The medication can cause dependency if used long-term. C. The medication should be stopped abruptly when symptoms improve. D. The medication has no side effects. Answer: B. The medication can cause dependency if used long-term. Rationale: benzodiazepines can cause physical and psychological dependency if used long-term. The medication should not be stopped abruptly, and it should be used as prescribed to minimize risk. It also has potential side effects, including drowsiness. 42. A nurse is caring for a patient receiving an antidepressant. Which of the following should the nurse monitor for early signs of serotonin syndrome? A. Increased appetite and weight gain. B. Tremors, confusion, and fever. C. Decreased blood pressure. D. Extreme fatigue and lethargy. Answer: B. Tremors, confusion, and fever. Rationale: serotonin syndrome is a potentially life-threatening condition associated with excessive serotonin levels and presents with tremors, confusion, and fever. Increased appetite and weight gain are not symptoms, and decreased blood pressure or fatigue are not indicative of serotonin syndrome. 43. A nurse is caring for a patient diagnosed with borderline personality disorder, BPD. Which of the following interventions would be most helpful? A. Establish clear, consistent boundaries. B. Encourage the patient to avoid all interpersonal interactions. C. Offer vague guidelines to reduce conflict. D. Allow the patient to have complete control over decisions. Answer: A. Establish clear, consistent boundaries. Rationale: establishing clear, consistent boundaries is crucial in managing BPD to provide structure and reduce emotional dysregulation. Avoiding interpersonal interactions, offering vague guidelines, or allowing complete control can increase instability. 44. A nurse is working with a patient with social anxiety disorder. Which of the following is an effective therapeutic approach? A. Encourage the patient to avoid social situations entirely. B. Gradually introduce the patient to social interactions. C. Focus solely on cognitive distortions. D. Promote isolation to reduce anxiety. Answer. B. Gradually introduce the patient to social interactions. Rationale. Gradual exposure to social situations helps desensitize the patient to anxiety triggers. Avoiding situations and focusing solely on cognitive distortions may not effectively address the underlying anxiety. Promoting isolation may worsen the disorder. 45. Which of the following is a common symptom of attention deficit/hyperactivity disorder, ADHD? A. Impulsivity and hyperactivity. B. Excessive sleepiness and fatigue. C. Delusions and hallucinations. D. Extreme social withdrawal. Answer. A. Impulsivity and hyperactivity. Rationale. Impulsivity and hyperactivity are hallmark symptoms of ADHD, along with inattention. Delusions, hallucinations, and extreme social withdrawal are not symptoms of ADHD. 46. A patient with schizophrenia exhibits catatonia. What is the most appropriate nursing intervention? A. Allow the patient to remain in their position without disturbance. B. Encourage the patient to express emotions freely. C. Provide physical restraints to prevent injury. D. Offer medications to reduce symptoms. Answer. A. Allow the patient to remain in their position without disturbance. Rationale. In cases of catatonia, it is essential to avoid overstimulating the patient. Restraints or forcing the patient to move may increase stress. Offering medications is necessary, but not the first intervention in catatonic states. 47. A nurse is assessing a patient diagnosed with dissociative identity disorder. Which of the following is a common symptom of this disorder? A. Sudden, rapid mood swings. B. Multiple distinct personality states. C. Inability to recall personal information. D. Recurrent intrusive thoughts. Answer. B. Multiple distinct personality states. Rationale. Dissociative identity disorder is characterized by the presence of two or more distinct personality states. Mood swings, memory recall issues, and intrusive thoughts may be present, but are not defining symptoms of the disorder. 48. Which of the following is a key feature of narcissistic personality disorder? A. Preoccupation with being rejected. B. Excessive need for admiration. C. Strong desire for social connections. D. Chronic feelings of emptiness. Answer. B. Excessive need for admiration. Rationale. People with narcissistic personality disorder often have an excessive need for admiration and a sense of entitlement. Preoccupation with rejection, social connections, and feelings of emptiness are more characteristic of other personality disorders. 49. A nurse is caring for a patient with dissociative amnesia. Which of the following is a common characteristic of this disorder? A. Inability to recall specific information about themselves or events. B. Consistent memory of past events and personal identity. C. Intrusive memories of traumatic experiences. D. Loss of consciousness for extended periods. Answer. A. Inability to recall specific information about themselves or events. Rationale. Dissociative amnesia is characterized by an inability to recall personal information or events, typically after a traumatic experience. Intrusive memories or loss of consciousness are not characteristic of this disorder. 50. A nurse is caring for a patient who is receiving treatment for depression with electroconvulsive therapy, ECT. Which of the following is a common side effect? A. Headache and confusion. B. Weight gain and fatigue. C. Dry mouth and dizziness. D. Excessive hunger and thirst. Answer. A. Headache and confusion. Rationale. Headache and confusion are common side effects of ECT. Weight gain, dry mouth, dizziness, excessive hunger, and thirst are not typically associated with this treatment. 51. A nurse is caring for a patient with major depressive disorder. Which of the following should the nurse include in the patient's plan of care? A. Encourage isolation to reduce stress. B. Provide frequent opportunities for the patient to discuss feelings. C. Avoid discussing the patient's feelings. D. Encourage the patient to avoid all physical activity. Answer. B. Provide frequent opportunities for the patient to discuss feelings. Rationale. Encouraging the patient to discuss their feelings in a safe environment is crucial in treating depression. Isolation, avoiding emotional discussions, and discouraging physical activity are not effective or therapeutic approaches. 52. A nurse is working with a patient diagnosed with generalized anxiety disorder. Which of the following is a common physical symptom of this disorder? A. Decreased heart rate. B. Nausea and gastrointestinal distress. C. Low blood pressure. D. Increased appetite. Answer. B. Nausea and gastrointestinal distress. Rationale. People with generalized anxiety disorder commonly experience physical symptoms such as nausea, GI distress, and muscle tension. Decreased heart rate, low blood pressure, and increased appetite are not typical of GAD. 53. A nurse is caring for a patient with a history of self-harm. Which of the following should be the priority nursing intervention? A. Offer the patient reassurance. B. Create a safe environment. C. Encourage socialization. D. Ignore the behavior to avoid reinforcement. Answer. B. Create a safe environment. Rationale. The priority is to ensure the patient's safety by creating an environment that reduces the risk of self-harm. Reassurance, socialization, and ignoring the behavior do not directly address the immediate safety needs. 54. A nurse is teaching a patient about selective serotonin reuptake inhibitors, SSRIs. Which of the following side effects should be discussed? A. Drowsiness and sedation. B. Weight gain and increased appetite. C. Nausea, headache, and sexual dysfunction. D. Elevated blood pressure and tachycardia. Answer. C. Nausea, headache, and sexual dysfunction. Rationale. SSRIs commonly cause side effects such as nausea, headache, and sexual dysfunction. Drowsiness, weight gain, elevated blood pressure, and tachycardia are more commonly associated with other medication classes. 55. A nurse is caring for a patient who has been prescribed a mood stabilizer. Which of the following is the nurse's primary concern during treatment? A. Risk for increased blood pressure. B. Risk for dehydration and electrolyte imbalance. C. Risk for hyperglycemia. D. Risk for elevated liver enzymes. Answer. B. Risk for dehydration and electrolyte imbalance. Rationale. Mood stabilizers, especially lithium, can cause dehydration and electrolyte imbalances. Blood pressure, hyperglycemia, and liver enzymes may also be concerns, but are not the primary focus during initial treatment. 56. A nurse is caring for a patient who is diagnosed with a substance use disorder. The patient states, "I can stop drinking anytime I want." Which of the following is the most appropriate response? A. You should try to stop immediately. B. That's a common belief among people with alcohol addiction. C. It's up to you when you want to quit. D. There are no real risks involved with stopping on your own. Answer. B. That's a common belief among people with alcohol addiction. Rationale. Denial is a common symptom in patients with substance use disorders. Acknowledging the patient's belief while addressing the nature of addiction is appropriate. The other responses minimize the patient's condition or suggest unsafe practices. 57. A nurse is educating a patient diagnosed with schizophrenia about antipsychotic medications. Which of the following side effects should the nurse discuss? A. Weight loss and dizziness. B. Extrapyramidal symptoms and sedation. C. Increased energy and alertness. D. Increased appetite and euphoria. Answer. B. Extrapyramidal symptoms and sedation. Rationale. Extrapyramidal symptoms, such as tremors and rigidity, and sedation are common side effects of antipsychotic medications. Weight loss, increased energy, and euphoria are less typical side effects of these medications. 58. A nurse is caring for a patient with obsessive-compulsive disorder, OCD. Which of the following interventions should be included in the care plan? A. Encourage the patient to resist performing rituals. B. Provide structured routines for activities. C. Limit opportunities for the patient to engage in rituals. D. Punish the patient for engaging in rituals. Answer. B. Provide structured routines for activities. Rationale. Providing structure can help reduce anxiety and improve functioning in patients with OCD. Encouraging the patient to resist rituals or limiting engagement may increase anxiety, and punishment is never an appropriate intervention. 59. A nurse is caring for a patient diagnosed with anorexia nervosa. Which of the following is the most important nursing priority? A. Encourage the patient to eat large meals. B. Promote a positive body image. C. Monitor the patient's weight and vital signs. D. Allow the patient to control all food choices. Answer. C. Monitor the patient's weight and vital signs. Rationale. The priority is to monitor for signs of malnutrition and physical complications associated with anorexia nervosa. Encouraging large meals and allowing total control over food choices are not appropriate in the early stages of treatment. 60. A nurse is assessing a patient who has been prescribed a benzodiazepine for anxiety. Which of the following is the nurse's primary concern? A. Risk for dependency and withdrawal symptoms. B. Risk for dehydration. C. Risk for liver toxicity. D. Risk for increased appetite. Answer. A. Risk for dependency and withdrawal symptoms. Rationale. Benzodiazepines can be habit-forming, and long-term use can lead to dependency and withdrawal symptoms. Dehydration, liver toxicity, and increased appetite are less common concerns. 61. A nurse is teaching a patient about the use of a selective serotonin-norepinephrine reuptake inhibitor, SNRI. Which of the following should be included in the teaching? A. You should avoid taking this medication with alcohol. B. This medication works immediately to improve your mood. C. You can take this medication on an as-needed basis. D. The medication may cause significant weight gain. Answer. A. You should avoid taking this medication with alcohol. Rationale. Alcohol should be avoided when taking SNRIs due to the increased risk of side effects, including sedation and dizziness. The medication does not work immediately, it is not taken on an as-needed basis, and significant weight gain is not a common side effect. 62. A nurse is caring for a patient diagnosed with borderline personality disorder, BPD. Which of the following behaviors is most characteristic of this disorder? A. Intense fear of abandonment. B. Stable relationships with others. C. Consistently high self-esteem. D. Difficulty with attention and focus. Answer. A. Intense fear of abandonment. Rationale. People with BPD often have an intense fear of abandonment and may engage in impulsive behaviors to avoid perceived rejection. Stable relationships and high self-esteem are not characteristic of BPD. Attention issues may be present, but are not the hallmark symptom. 63. A nurse is caring for a patient diagnosed with bipolar disorder. The patient is currently experiencing a depressive episode. Which of the following is a priority intervention? A. Provide emotional support and listen actively. B. Encourage the patient to engage in physical activity. C. Set limits on any verbal or physical aggression. D. Offer the patient opportunities for group therapy. Answer. A. Provide emotional support and listen actively. Rationale. Providing emotional support and actively listening can help the patient cope with a depressive episode. Encouraging physical activity or group therapy may not be well received in this phase, and setting limits is not a priority unless aggression is present. 64. A nurse is teaching a patient who has been prescribed a tricyclic antidepressant, TCA. Which of the following side effects should the nurse emphasize? A. Drowsiness, dry mouth, and blurred vision. B. Weight loss and agitation. C. Hyperactivity and insomnia. D. Increased libido and euphoric mood. Answer. A. Drowsiness, dry mouth, and blurred vision. Rationale. TCAs commonly cause side effects like drowsiness, dry mouth, and blurred vision. Weight loss, hyperactivity, and increased libido are not typical side effects of TCAs. 65. A nurse is caring for a patient diagnosed with post-traumatic stress disorder, PTSD. Which of the following is the most important intervention? A. Encourage the patient to suppress their emotions. B. Provide a safe and supportive environment. C. Avoid discussing the traumatic event. D. Allow the patient to withdraw from social activities. Answer. B. Provide a safe and supportive environment. Rationale. A safe and supportive environment is crucial for patients with PTSD to feel secure and manage symptoms. Encouraging suppression, avoiding discussions, and promoting withdrawal can worsen symptoms. 66. A nurse is caring for a patient diagnosed with schizophrenia. The patient exhibits delusions of persecution. Which of the following is the most appropriate intervention? A. Agree with the patient's delusions to build rapport. B. Ignore the delusions and focus on other aspects of care. C. Gently redirect the patient to reality-based thinking. D. Confront the delusion directly to challenge it. Answer. C. Gently redirect the patient to reality-based thinking. Rationale. Gently redirecting the patient to reality-based thinking helps address delusions without confrontation. Agreeing with delusions or ignoring them may reinforce them, and confronting them aggressively may increase anxiety. 67. A nurse is caring for a patient with anxiety. Which of the following interventions is most appropriate for acute anxiety episodes? A. Encourage deep breathing and relaxation techniques. B. Encourage the patient to focus on negative thoughts. C. Encourage the patient to avoid social interactions. D. Offer the patient a high dose of sedatives. Answer. A. Encourage deep breathing and relaxation techniques. Rationale. Deep breathing and relaxation techniques can help reduce acute anxiety. Focusing on negative thoughts, avoiding social interactions, or using sedatives are not the best first-line interventions for managing anxiety. 68. A nurse is caring for a patient with psychosis. Which of the following interventions is most appropriate? A. Provide a quiet environment to reduce stimuli. B. Encourage the patient to socialize with peers. C. Challenge the patient's delusions. D. Provide detailed explanations about the patient's condition. Answer. A. Provide a quiet environment to reduce stimuli. Rationale. A quiet environment can help reduce stimulation and anxiety in a patient with psychosis. Encouraging socialization, challenging delusions, or over-explaining may increase confusion and anxiety. 69. A nurse is caring for a patient diagnosed with depression. The patient expresses feelings of hopelessness. Which of the following is the priority action? A. Assess the patient for suicidal ideation. B. Encourage the patient to participate in group activities. C. Provide reassurance that things will improve. D. Offer praise for any positive behaviors. Answer. A. Assess the patient for suicidal ideation. Rationale. The priority is to assess for suicidal ideation, as feelings of hopelessness can lead to suicide. Encouragement and reassurance are important, but secondary to ensuring the patient's safety. 70. A nurse is assessing a patient who is experiencing a panic attack. Which of the following is the most appropriate nursing intervention? A. Encourage the patient to take slow, deep breaths. B. Provide the patient with a sedative immediately. C. Ask the patient to identify the cause of the panic attack. D. Encourage the patient to focus on a particular thought. Answer. A. Encourage the patient to take slow, deep breaths. Rationale. During a panic attack, the priority intervention is to help the patient regulate breathing to reduce physical symptoms of anxiety. Providing sedatives or focusing on the cause may not help immediately, and identifying the cause can escalate anxiety. 71. A nurse is caring for a patient diagnosed with obsessive-compulsive disorder, OCD. Which of the following interventions is most appropriate? A. Tell the patient to stop performing rituals. B. Provide a structured routine for activities. C. Allow the patient to engage in rituals for as long as desired. D. Ignore the patient's compulsive behavior. Answer. B. Provide a structured routine for activities. Rationale. A structured routine can help reduce anxiety and provide predictability for the patient. Telling the patient to stop rituals abruptly may increase anxiety, while ignoring or allowing the behavior to persist without limit is not therapeutic. 72. A nurse is teaching a patient about the side effects of an antidepressant medication. Which of the following should be discussed? A. Risk of weight loss and tremors. B. Risk of suicidal ideation, especially in the early stages of treatment. C. Risk of blurred vision and excessive salivation. D. Risk of euphoria and increased energy. Answer: B. Risk of suicidal ideation, especially in the early stages of treatment. Rationale: suicidal ideation can increase when starting antidepressants, particularly in younger patients. Weight loss, blurred vision, excessive salivation, and euphoria are not common or expected side effects of antidepressants. 73. A nurse is caring for a patient diagnosed with schizophrenia who is experiencing auditory hallucinations. Which of the following is the most appropriate nursing intervention? A. Ignore the hallucinations and continue with the assessment. B. Acknowledge the patient's feelings and validate their experience. C. Argue with the patient about the hallucinations being unreal. D. Tell the patient that they should not experience hallucinations. Answer: B. Acknowledge the patient's feelings and validate their experience. Rationale: acknowledging the patient's feelings helps to establish rapport and trust while gently redirecting them toward reality. Arguing or dismissing the hallucinations may increase anxiety or mistrust. Ignoring them is not therapeutic. 74. A nurse is teaching a patient about the use of benzodiazepines for anxiety. Which of the following should be included in the teaching plan? A. Avoid taking the medication with alcohol. B. The medication can be used long-term without risks. C. The medication can be abruptly discontinued once symptoms improve. D. The medication will not cause drowsiness. Answer: A. Avoid taking the medication with alcohol. Rationale: benzodiazepines can cause drowsiness and sedation, and alcohol can enhance these effects, so it should be avoided. Benzodiazepines are generally used for short-term treatment, not long-term, and should not be abruptly discontinued. 75. A nurse is caring for a patient diagnosed with bipolar disorder during a manic episode. Which of the following is the most appropriate nursing intervention? A. Provide a quiet, low-stimulation environment. B. Encourage the patient to engage in physical activities. C. Allow the patient to make their own decisions without restrictions. D. Set firm, consistent limits on behavior. Answer: D. Set firm, consistent limits on behavior. Rationale: patients in a manic episode may display impulsive or inappropriate behaviors. Setting firm and consistent limits is crucial to manage these behaviors and ensure safety. Quiet environments may be beneficial, but setting limits is the priority. 76. A nurse is caring for a patient with major depressive disorder. The patient says, "I don't think I will ever get better." Which of the following is the most appropriate response? A. You're just feeling down. Things will get better soon. B. I understand you're feeling hopeless, but with treatment, things can improve. C. There's no reason for you to feel this way. Try to think positively. D. Don't worry. You're just going through a phase. Answer: B. I understand you're feeling hopeless, but with treatment, things can improve. Rationale: acknowledging the patient's feelings of hopelessness while offering reassurance about the potential for improvement is a therapeutic response. Minimizing the patient's feelings or offering false reassurances is not helpful. 77. A nurse is caring for a patient diagnosed with schizophrenia who is taking an antipsychotic medication. Which of the following side effects should the nurse monitor for? A. Hypertension and tachycardia. B. Extrapyramidal symptoms and tardive dyskinesia. C. Weight loss and increased energy. D. Insomnia and hyperactivity. Answer: B. Extrapyramidal symptoms and tardive dyskinesia. Rationale: antipsychotic medications can cause extrapyramidal symptoms such as tremors and rigidity and tardive dyskinesia, involuntary movements. hypertension, tachycardia, weight loss, and insomnia are not typical side effects of antipsychotic medications. 78. A nurse is caring for a patient with alcohol use disorder. Which of the following is the priority nursing intervention during alcohol withdrawal? A. Offer supportive therapy and encouragement. B. Administer medications to prevent seizures and delirium tremens. C. Encourage the patient to attend a support group. D. Allow the patient to rest in a quiet environment. Answer: B. Administer medications to prevent seizures and delirium tremens. Rationale: the priority during alcohol withdrawal is to manage withdrawal symptoms and prevent complications, such as seizures and delirium tremens. Supportive care and encouragement are important, but the focus is on the safety of the patient. 79. A nurse is caring for a patient diagnosed with anorexia nervosa. Which of the following is the most important nursing intervention? A. Encourage the patient to engage in a strict exercise regimen. B. Monitor the patient's weight and vital signs regularly. C. Praise the patient for eating large meals. D. Allow the patient to choose their meals without restrictions. Answer: B. Monitor the patient's weight and vital signs regularly. Rationale: close monitoring of weight and vital signs is critical to assess for complications such as malnutrition and dehydration. Strict exercise regimens and praising large meals are not appropriate, and allowing unrestricted choice may not be appropriate in the early stages of treatment. 80. A nurse is educating a patient about the use of a selective serotonin reuptake inhibitor, SSRI, for depression. Which of the following should be included in the teaching plan? A. You should avoid taking this medication with alcohol. B. This medication will immediately improve your mood. C. This medication is safe to take for as long as you want. D. You should expect to feel sedated while taking this medication. Answer: A. You should avoid taking this medication with alcohol. Rationale: alcohol can enhance the sedative effects of SSRIs, so it should be avoided. SSRIs may take several weeks to have full effect, they are not typically used indefinitely without review, and sedation is not a typical side effect. 81. A nurse is caring for a patient who has been prescribed a mood stabilizer for bipolar disorder. Which of the following should the nurse emphasize during teaching? A. Report any signs of excessive thirst or urination. B. You can stop the medication once you feel better. C. This medication may cause significant weight loss. D. It is important to take the medication only during manic episodes. Answer: A. Report any signs of excessive thirst or urination. Rationale: a common side effect of mood stabilizers like lithium is increased thirst and urination, which could indicate toxicity. Stopping the medication abruptly or only using it during manic episodes is not recommended. 82. A nurse is caring for a patient diagnosed with post-traumatic stress disorder, PTSD. Which of the following interventions is most appropriate? A. Encourage the patient to avoid discussing the traumatic event. B. Offer the patient opportunities to express their feelings at their own pace. C. Encourage the patient to suppress distressing memories. D. Advise the patient to engage in avoidance behaviors to reduce anxiety. Answer: B. Offer the patient opportunities to express their feelings at their own pace. Rationale: encouraging expression of feelings in a safe and gradual manner can help the patient process trauma. Suppressing memories or avoidance can exacerbate symptoms of PTSD. 83. A nurse is caring for a patient diagnosed with a panic disorder. Which of the following medications is commonly prescribed to manage panic attacks? A. Beta blockers. B. Antipsychotics. C. Selective serotonin reuptake inhibitors, SSRIs. D. Benzodiazepines. Answer: D. Benzodiazepines. Rationale: benzodiazepines are commonly prescribed to manage acute panic attacks due to their calming effect. SSRIs may be used for long-term management of panic disorder. Beta blockers and antipsychotics are not typically used for panic attacks. 84. A nurse is teaching a patient about the use of an antidepressant. The nurse should explain that it may take several weeks to see therapeutic effects due to which of the following mechanisms? A. Antidepressants enhance serotonin and norepinephrine activity in the brain. B. Antidepressants cause an immediate increase in brain dopamine levels. C. Antidepressants stimulate neurogenesis in the hippocampus. D. Antidepressants directly activate brain receptors to produce an immediate response. Answer: A. Antidepressants enhance serotonin and norepinephrine activity in the brain. Rationale: antidepressants take time to show effects because they work by gradually increasing serotonin and norepinephrine activity, which leads to mood improvement. Immediate changes in dopamine or direct receptor activation are not mechanisms of action for antidepressants. 85. A nurse is caring for a patient who is experiencing auditory hallucinations. Which of the following interventions is most appropriate? A. Focus on the patient's hallucinations to explore their meaning. B. Encourage the patient to engage in activities that distract from the hallucinations. C. Tell the patient the hallucinations are not real. D. Agree with the patient's hallucinations to provide support. Answer: B. Encourage the patient to engage in activities that distract from the hallucinations. Rationale: distracting the patient with activities can help redirect attention away from the hallucinations and reduce their distress. Telling the patient the hallucinations are not real or agreeing with them may increase confusion or reinforce the delusion. 86. A nurse is caring for a patient diagnosed with bipolar disorder who is experiencing a manic episode. Which of the following is the most appropriate intervention? A. Limit social interactions and set clear boundaries. B. Encourage the patient to make spontaneous decisions. C. Allow the patient to engage in impulsive behaviors. D. Ignore the patient's behavior to avoid confrontation. Answer: A. Limit social interactions and set clear boundaries. Rationale: limiting social interactions and setting clear boundaries helps manage manic behaviors. Encouraging impulsive decisions or ignoring behavior can increase risk and exacerbate symptoms. 87. A nurse is caring for a patient diagnosed with depression. Which of the following interventions is most appropriate? A. Offer the patient choices and promote independence. B. Avoid discussing feelings to prevent overwhelming the patient. C. Encourage the patient to focus on the past. D. Minimize the patient's emotional responses. Answer: A. Offer the patient choices and promote independence. Rationale: encouraging independence and offering choices helps empower the patient and promote a sense of control. Avoiding feelings or minimizing emotions can lead to feelings of isolation and invalidation. 88. A nurse is teaching a patient about lithium therapy for bipolar disorder. Which of the following should the nurse emphasize regarding lithium therapy? A. Monitor for signs of dehydration and excessive thirst. B. Take the medication only during manic episodes. C. Lithium does not require routine blood level monitoring. D. Lithium causes significant weight loss. Answer: A. Monitor for signs of dehydration and excessive thirst. Rationale: lithium therapy requires monitoring for dehydration, which can increase the risk of toxicity. Lithium should be taken consistently, not just during manic episodes, and requires regular blood monitoring. Weight loss is not a typical side effect. 89. A nurse is caring for a patient diagnosed with major depressive disorder. The patient expresses feelings of guilt and worthlessness. Which of the following is the most appropriate nursing response? A. You shouldn't feel guilty. You have nothing to be ashamed of. B. I understand you're feeling guilty, but it's important to recognize that these feelings are part of depression. C. You need to snap out of it and focus on the positive. D. Don't worry, things will get better soon. Answer: B. I understand you're feeling guilty, but it's important to recognize that these feelings are part of depression. Rationale: acknowledging the patient's feelings and providing a realistic perspective is important. Minimizing, denying, or offering false reassurances is not helpful. 90. A nurse is caring for a patient diagnosed with borderline personality disorder. Which of the following behaviors should the nurse expect? A. Difficulty maintaining relationships due to impulsivity. B. Strong interest in group therapy participation. C. Emotional stability and long-term consistency in relationships. D. Reluctance to express feelings of anger or frustration. Answer: A. difficulty maintaining relationships due to impulsivity. Rationale, patients with borderline personality disorder typically exhibit impulsivity and difficulty maintaining stable relationships. Group therapy can be challenging and emotional instability is common. Difficulty managing emotions is also characteristic. 91. A nurse is caring for a patient with generalized anxiety disorder, GAD. Which of the following should be included in the treatment plan? A. Cognitive behavioral therapy, CBT. B. Anxiolytics to be used long-term. C. Encourage isolation to reduce stress. D. Involuntary admission for behavioral modification. Answer: A. Cognitive behavioral therapy, CBT. Rationale: cognitive behavioral therapy, CBT, is a first-line treatment for generalized anxiety disorder, GAD, focusing on altering negative thought patterns. Anxiolytics are usually prescribed for short-term use, and isolation and involuntary admission are not appropriate interventions for GAD. 92. A nurse is caring for a patient who has been prescribed fluoxetine, Prozac, for depression. Which of the following side effects should the nurse monitor for? A. Weight gain and excessive sleepiness. B. Sexual dysfunction and insomnia. C. Hypertension and increased energy. D. Drowsiness and dry mouth. Answer: B. Sexual dysfunction and insomnia. Rationale: common side effects of SSRIs like fluoxetine, Prozac, include sexual dysfunction and insomnia. Weight gain, hypertension, and drowsiness are not typical side effects of SSRIs. 93. A nurse is caring for a patient with panic disorder. The patient reports experiencing chest pain, rapid heartbeat, and a sense of impending doom. Which of the following actions should the nurse take first? A. Encourage the patient to relax and take slow, deep breaths. B. Administer prescribed anti-anxiety medication. C. Call the healthcare provider immediately. D. Offer the patient a glass of water to calm them. Answer: A. Encourage the patient to relax and take slow, deep breaths. Rationale: the first intervention for a patient experiencing panic is to help them regulate breathing and reduce anxiety. Administering medication or calling the healthcare provider may be necessary later, but breathing exercises should be the first step. 94. A nurse is caring for a patient diagnosed with a dissociative identity disorder, DID. Which of the following interventions is most appropriate? A. Encourage the patient to focus on the traumatic event. B. Provide a safe and supportive environment. C. Encourage the patient to suppress different identities. D. Confront the patient with their alternate identities. Answer: B. Provide a safe and supportive environment. Rationale: the most important intervention for DID is creating a safe and supportive environment to help the patient integrate their identities gradually. Focusing on trauma, suppressing identities, or confronting the patient may lead to distress or destabilization. 95. A nurse is caring for a patient diagnosed with alcohol use disorder. Which of the following medications is commonly used to prevent alcohol relapse? A. Naltrexone, Revia. B. Lorazepam, Ativan. C. Sertraline, Zoloft. D. Methylphenidate, Ritalin. Answer: A. Naltrexone, Revia. Rationale: naltrexone, Revia, is commonly prescribed to help prevent alcohol relapse by reducing cravings. Lorazepam is used for alcohol withdrawal symptoms, while sertraline is an SSRI for depression, and methylphenidate is a stimulant used for ADHD. 96. A nurse is assessing a patient with depression who is experiencing feelings of worthlessness. Which of the following statements should the nurse make? A. You should stop feeling sorry for yourself. B. I understand you are feeling hopeless, but these feelings can improve with treatment. C. You're overreacting. Others have it worse than you. D. Try to focus on the positive aspects of your life. Answer: B. I understand you are feeling hopeless, but these feelings can improve with treatment. Rationale: acknowledging the patient's feelings of hopelessness while offering reassurance that treatment can help is supportive. Minimizing feelings or offering unsolicited advice is not therapeutic. 97. A nurse is teaching a patient diagnosed with schizophrenia about antipsychotic medications. Which of the following should be included in the teaching? A. You may experience dry mouth and blurred vision while on this medication. B. Antipsychotics have no significant side effects. C. Take the medication only during acute episodes of schizophrenia. D. This medication will help cure your schizophrenia. Answer: A. You may experience dry mouth and blurred vision while on this medication. Rationale: antipsychotic medications can cause side effects like dry mouth, blurred vision, and sedation. They do not cure schizophrenia, and they should be taken regularly, not just during acute episodes. 98. A nurse is caring for a patient diagnosed with obsessive-compulsive disorder, OCD. Which of the following interventions is most appropriate? A. Allow the patient to engage in rituals without limitation. B. Gradually reduce the frequency of the patient's rituals. C. Discourage the patient from talking about their rituals. D. Set strict limits on the patient's compulsive behavior. Answer: B. Gradually reduce the frequency of the patient's rituals. Rationale: gradually reducing the frequency of rituals can help the patient manage compulsions while still providing support. Allowing unlimited rituals or setting strict limits abruptly may increase anxiety. 99. A nurse is caring for a patient diagnosed with major depressive disorder. Which of the following is the priority nursing diagnosis? A. Impaired social interaction. B. Risk for suicide. C. Ineffective coping. D. Disturbed sleep pattern. Answer: B. Risk for suicide. Rationale: the priority nursing diagnosis is always risk for suicide in patients with depression, as it is a life-threatening risk. While other diagnoses are important, safety takes precedence. 100. A nurse is caring for a patient diagnosed with bulimia nervosa. Which of the following findings should the nurse expect? A. Excessive weight loss and amenorrhea. B. Episodes of binge eating followed by purging. C. Consistent weight maintenance with no purging. D. Intense fear of gaining weight despite low body weight. Answer: B. Episodes of binge eating followed by purging. Rationale: bulimia nervosa is characterized by episodes of binge eating followed by compensatory behaviors, such as vomiting or excessive exercise. Weight loss and amenorrhea are more characteristic of anorexia nervosa. 101. A nurse is caring for a patient diagnosed with schizophrenia who is exhibiting delusions. Which of the following actions should the nurse take? A. Argue with the patient about the delusions being unreal. B. Reassure the patient that they are safe and that their thoughts are being heard. C. Ignore the delusions and continue with the conversation. D. Agree with the patient's delusions to provide comfort. Answer: B. Reassure the patient that they are safe and that their thoughts are being heard. Rationale: reassuring the patient that they are safe while acknowledging their thoughts can help reduce anxiety. Arguing or agreeing with the delusions can escalate the situation. 102. A nurse is caring for a patient diagnosed with a phobia. Which of the following is the most effective treatment for phobias? A. Electroconvulsive therapy, ECT. B. Systematic desensitization. C. Group therapy. D. Antidepressant medication. Answer: B. Systematic desensitization. Rationale: systematic desensitization is a therapeutic technique used to gradually expose a patient to the feared object or situation, helping reduce the phobic response. ECT is not typically used for phobias, and group therapy and antidepressants are not first-line treatments for phobias. 103. A nurse is caring for a patient diagnosed with post-traumatic stress disorder, PTSD. Which of the following interventions should be included in the treatment plan? A. Encourage the patient to avoid talking about the traumatic event. B. Teach relaxation techniques to reduce anxiety. C. Use aversion therapy to eliminate flashbacks. D. Encourage the patient to focus on the past. Answer: B. Teach relaxation techniques to reduce anxiety. Rationale: relaxation techniques help reduce anxiety and manage the physical symptoms of PTSD. Encouraging avoidance or focusing on the past is not helpful. 104. A nurse is assessing a patient with a history of substance use disorder. Which of the following signs may indicate the patient is in withdrawal? A. Slurred speech and slowed reflexes. B. Increased blood pressure, tremors, and sweating. C. Euphoria and increased energy levels. D. Increased appetite and drowsiness. Answer. B. Increased blood pressure, tremors, and sweating. Rationale. Withdrawal symptoms often include increased blood pressure, tremors, and sweating. Slurred speech and euphoria are not typical withdrawal symptoms. 105. A nurse is teaching a patient about the use of a stimulant medication for attention deficit hyperactivity disorder, ADHD. Which of the following should be included in the teaching plan? A. You should take this medication before bedtime. B. This medication may cause an increase in appetite. C. You may experience insomnia or decreased appetite with this medication. D. You can stop the medication if you feel better. Answer. C. You may experience insomnia or decreased appetite with this medication. Rationale. Stimulants for ADHD can cause side effects like insomnia and decreased appetite. They should not be taken at bedtime, and the medication is typically continued as part of ongoing treatment. 106. A nurse is caring for a patient diagnosed with anorexia nervosa. Which of the following is the priority nursing intervention? A. Encourage the patient to eat large portions of food. B. Monitor the patient's vital signs and weight regularly. C. Allow the patient to control the amount of food consumed. D. Engage the patient in group therapy. Answer. B. Monitor the patient's vital signs and weight regularly. Rationale. Monitoring vital signs and weight is essential to assess for complications such as malnutrition and dehydration. Encouraging large portions or allowing the patient to control food intake may not be appropriate during the early stages of treatment. 107. A nurse is teaching a patient diagnosed with depression about the use of selective serotonin reuptake inhibitors, SSRIs. Which of the following should be included in the teaching plan? A. You may experience increased energy and euphoria within the first few days. B. It may take several weeks for you to feel the full effects of the medication. C. You should discontinue the medication as soon as you feel better. D. This medication will immediately relieve your symptoms of depression. Answer. B. It may take several weeks for you to feel the full effects of the medication. Rationale. SSRIs typically take several weeks to show therapeutic effects. Stopping the medication abruptly or expecting immediate relief is not accurate. Increased energy and euphoria are not immediate effects. 108. A nurse is caring for a patient with a history of depression who is at risk for suicide. Which of the following actions should the nurse take? A. Encourage the patient to keep their thoughts and feelings private. B. Provide a safe environment by removing harmful objects. C. Allow the patient to express feelings of hopelessness without intervention. D. Tell the patient that their suicidal thoughts are not valid. Answer. B. Provide a safe environment by removing harmful objects. Rationale. Ensuring the safety of a patient at risk for suicide is the priority. Removing harmful objects from the environment can help prevent self-harm. Encouraging privacy or dismissing the patient's feelings may increase risk. 109. A nurse is caring for a patient with depression who expresses feelings of guilt. Which of the following is the most appropriate response? A. You have nothing to feel guilty about. B. I understand you're feeling guilty, but it's important to recognize that these feelings are part of your depression. C. Everyone feels guilty sometimes. Just try to think positively. D. Guilt is a normal part of depression, so you need to accept it. Answer. B. I understand you're feeling guilty, but it's important to recognize that these feelings are part of your depression. Rationale. Acknowledging the patient's feelings while explaining that guilt is a common symptom of depression helps normalize the experience and promotes understanding. Minimizing feelings or offering vague advice is not helpful. 110. A nurse is caring for a patient diagnosed with schizophrenia who is exhibiting violent behavior. Which of the following actions should the nurse take? A. Speak calmly and assertively, providing clear directions. B. Use restraints to prevent injury. C. Ignore the behavior until the patient calms down. D. Confront the patient about the violent behavior. Answer. A. Speak calmly and assertively, providing clear directions. Rationale. When dealing with violent behavior, a calm and assertive approach helps de-escalate the situation. Restraints should be used as a last resort, and ignoring or confronting the patient may worsen the aggression. 111. A nurse is caring for a patient diagnosed with schizophrenia who is experiencing auditory hallucinations. Which of the following interventions is most appropriate? A. Encourage the patient to engage in physical activity. B. Reassure the patient that the voices are not real. C. Encourage the patient to talk about the voices they hear. D. Speak to the patient in a calm, clear, and supportive manner. Answer: D. Speak to the patient in a calm, clear, and supportive manner. Rationale: when caring for a patient with auditory hallucinations, it's important to maintain a calm, clear, and supportive approach. Arguing about the reality of the hallucinations or overly focusing on them can escalate the situation. 112. A nurse is caring for a patient diagnosed with major depressive disorder who is considering suicide. Which of the following is the priority nursing action? A. Explore the patient's reasons for wanting to die. B. Provide the patient with privacy to express feelings. C. Maintain a safe environment by removing harmful items. D. Reassure the patient that everything will improve soon. Answer: C. Maintain a safe environment by removing harmful items. Rationale: the priority for a patient with suicidal ideation is to ensure safety by removing harmful objects. Exploring reasons or offering reassurance may be helpful, but safety is the primary concern. 113. A nurse is caring for a patient with post-traumatic stress disorder, PTSD, who is experiencing flashbacks. Which of the following is the most appropriate intervention? A. Encourage the patient to relive the traumatic event. B. Use grounding techniques to help the patient focus on the present. C. Administer sedatives to calm the patient. D. Limit the patient's interactions with others. Answer: B. Use grounding techniques to help the patient focus on the present. Rationale: grounding techniques are effective in helping a patient focus on the present and reduce the impact of flashbacks. Reliving the trauma or administering sedatives may exacerbate the symptoms. 114. A nurse is providing discharge teaching for a patient prescribed lithium for bipolar disorder. Which of the following should be included in the teaching? A. You may need to limit your salt intake while taking this medication. B. Lithium can be stopped once your mood improves. C. Lithium levels should be monitored regularly to avoid toxicity. D. You should avoid all physical exercise while on lithium. Answer: C. Lithium levels should be monitored regularly to avoid toxicity. Rationale: lithium requires regular monitoring of blood levels to avoid toxicity. Salt intake should not be overly restricted, and lithium is not discontinued once mood improves. Ongoing treatment is needed. 115. A nurse is caring for a patient diagnosed with obsessive-compulsive disorder, OCD, who is engaging in repetitive hand-washing. Which of the following actions should the nurse take? A. Limit the amount of time the patient is allowed to engage in the behavior. B. Encourage the patient to resist the compulsion. C. Allow the patient to continue the behavior without interruption. D. Provide the patient with a task to distract them from the behavior. Answer: B. Encourage the patient to resist the compulsion. Rationale: encouraging the patient to resist compulsive behaviors, such as repetitive hand-washing, helps the patient learn to manage their symptoms. Limiting or interrupting the behavior abruptly may increase anxiety. 116. A nurse is caring for a patient diagnosed with an anxiety disorder who is prescribed a benzodiazepine. Which of the following side effects should the nurse monitor for? A. Increased energy and euphoria. B. Drowsiness and dizziness. C. Increased appetite and weight gain. D. Tachycardia and hypertension. Answer: B. Drowsiness and dizziness. Rationale: benzodiazepines commonly cause drowsiness, dizziness, and sedation. They do not typically cause increased energy, appetite changes, or cardiovascular symptoms. 117. A nurse is caring for a patient diagnosed with bulimia nervosa. Which of the following interventions is most appropriate for promoting a positive body image? A. Encourage the patient to avoid mirrors to prevent body image concerns. B. Provide nutrition education and focus on health rather than appearance. C. Encourage the patient to engage in strenuous physical activity. D. Focus on the patient's weight loss as an indicator of progress. Answer. B. Provide nutrition education and focus on health rather than appearance. Rationale. Focusing on health and nutrition rather than appearance or weight can help promote a positive body image. Avoiding mirrors and focusing solely on weight loss can exacerbate the disorder. 118. A nurse is caring for a patient diagnosed with dissociative identity disorder, DID. Which of the following is an appropriate nursing intervention? A. Confront the patient about their alternate identities. B. Allow the patient to express and explore their identities in a safe environment. C. Ignore the different identities and focus on the primary personality. D. Restrict the patient's communication with others to prevent confusion. Answer. B. Allow the patient to express and explore their identities in a safe environment. Rationale. Allowing the patient to express and explore their identities in a safe, structured environment can help in the integration process. Confrontation or restriction of communication can increase stress and anxiety. 119. A nurse is caring for a patient diagnosed with schizophrenia who has been prescribed a first-generation antipsychotic. Which of the following side effects should the nurse monitor for? A. Tremors, rigidity, and bradykinesia. B. Dry mouth and blurred vision. C. Weight gain and sexual dysfunction. D. Insomnia and excessive energy. Answer. A. Tremors, rigidity, and bradykinesia. Rationale. First-generation antipsychotics, typical antipsychotics, are associated with extrapyramidal side effects such as tremors, rigidity, and bradykinesia. Dry mouth and blurred vision are more common with anticholinergic side effects. 120. A nurse is caring for a patient diagnosed with anorexia nervosa who has been receiving refeeding therapy. Which of the following is a potential complication of refeeding? A. Hyperglycemia and dehydration. B. Electrolyte imbalances and cardiac arrhythmias. C. Acute anxiety and insomnia. D. Increased blood pressure and muscle spasms. Answer. B. Electrolyte imbalances and cardiac arrhythmias. Rationale. Refeeding syndrome is a serious complication of refeeding therapy characterized by electrolyte imbalances, particularly hypophosphatemia, which can lead to cardiac arrhythmias. Monitoring electrolyte levels is crucial during refeeding. 121. A nurse is caring for a patient with schizophrenia who is exhibiting paranoia. Which of the following is the most appropriate intervention? A. Agree with the patient's beliefs to provide reassurance. B. Encourage the patient to confront the delusion directly. C. Acknowledge the patient's feelings without reinforcing the delusion. D. Discard the patient's thoughts and focus on rational discussion. Answer. C. Acknowledge the patient's feelings without reinforcing the delusion. Rationale. Acknowledging the patient's feelings while avoiding reinforcement of the delusion is a therapeutic approach. Agreeing with or dismissing the delusion may increase anxiety and confusion. 122. A nurse is caring for a patient diagnosed with a substance use disorder who is undergoing detoxification. Which of the following is the priority nursing intervention during the initial phase of detoxification? A. Encourage the patient to attend therapy sessions. B. Monitor the patient for withdrawal symptoms and provide comfort measures. C. Administer prescribed medication to treat co-occurring mental health disorders. D. Facilitate group support to address substance use triggers. Answer. B. Monitor the patient for withdrawal symptoms and provide comfort measures. Rationale. The priority during detoxification is monitoring for withdrawal symptoms, which can be life-threatening. Comfort measures and medical management of withdrawal symptoms are essential before other interventions like therapy or group support. 123. A nurse is caring for a patient diagnosed with bipolar disorder who is currently in a manic episode. Which of the following is the most appropriate intervention? A. Provide a structured, calm environment with minimal stimulation. B. Encourage the patient to engage in stimulating activities to release energy. C. Allow the patient to have unrestricted access to food and drink. D. Engage the patient in group activities to promote social interaction? Answer: A. Provide a structured, calm environment with minimal stimulation. Rationale: during a manic episode, it's important to provide a calm, structured environment with minimal stimulation to prevent agitation. Encouraging stimulating activities or social interaction may exacerbate the symptoms. 124. A nurse is caring for a patient diagnosed with an anxiety disorder. Which of the following techniques is most effective in helping the patient manage anxiety? A. Engaging the patient in physical exercise to expend energy. B. Teaching the patient relaxation techniques, such as deep breathing. C. Encouraging the patient to focus on the source of anxiety. D. Redirecting the patient's attention away from the anxiety-producing thoughts. Answer: B. Teaching the patient relaxation techniques, such as deep breathing. Rationale: teaching relaxation techniques like deep breathing is an effective method for managing anxiety. Focusing on the source of anxiety or using distractions may not address the underlying anxiety effectively. 125. A nurse is caring for a patient diagnosed with agoraphobia. Which of the following interventions is most appropriate? A. Encourage the patient to avoid situations that trigger anxiety. B. Gradually expose the patient to feared situations in a controlled manner. C. Provide a strict, structured schedule to avoid uncertainty. D. Encourage the patient to confront the fears head-on without assistance. Answer: B. Gradually expose the patient to feared situations in a controlled manner. Rationale: gradual exposure to feared situations in a controlled manner is the most effective treatment for agoraphobia. Avoiding situations or confronting fears abruptly may worsen the anxiety. 126. A nurse is caring for a patient with depression who is receiving electroconvulsive therapy, ECT. Which of the following is a common side effect of ECT? A. Loss of consciousness and confusion. B. Increased appetite and drowsiness. C. Muscle weakness and blurred vision. D. Increased anxiety and restlessness. Answer: A. Loss of consciousness and confusion. Rationale: a common side effect of ECT is temporary loss of consciousness and confusion immediately following the procedure. These effects are typically short-lived. 127. A nurse is assessing a patient with bulimia nervosa. Which of the following physical findings should the nurse expect? A. Dehydration and electrolyte imbalances. B. Weight loss and amenorrhea. C. Bradycardia and hypotension. D. Osteoporosis and frequent fractures. Answer: A. Dehydration and electrolyte imbalances. Rationale: bulimia nervosa is often associated with dehydration and electrolyte imbalances due to purging behaviors. Weight loss, bradycardia, and osteoporosis are more associated with anorexia nervosa. 128. A nurse is caring for a patient diagnosed with depression who is prescribed an SSRI. Which of the following side effects should the nurse educate the patient about? A. Increased energy and appetite. B. Sexual dysfunction and insomnia. C. Decreased anxiety and excessive sleepiness. D. Weight loss and hyperactivity. Answer: B. Sexual dysfunction and insomnia. Rationale: SSRIs commonly cause sexual dysfunction and insomnia. They do not typically lead to weight loss, hyperactivity, or increased energy. 129. A nurse is caring for a patient who is experiencing a panic attack. Which of the following interventions is most appropriate? A. Encourage the patient to hyperventilate to release tension. B. Stay with the patient, provide reassurance, and guide them to slow, deep breaths. C. Leave the patient alone to allow them to snap out of it. D. Provide the patient with stimulating activities to distract them. Answer: B. Stay with the patient, provide reassurance, and guide them to slow, deep breaths. Rationale: staying with the patient, offering reassurance, and guiding them to slow, deep breathing are key interventions to help manage a panic attack. Leaving the patient alone or offering distractions may worsen the anxiety. 130. A nurse is caring for a patient diagnosed with bipolar disorder who is prescribed lithium. Which of the following should be included in the nurse's assessment? A. Monitoring for signs of dehydration and kidney function. B. Assessing for changes in appetite and weight gain. C. Monitoring the patient's sleep patterns and activity level. D. Evaluating for the presence of auditory hallucinations. Answer: A. Monitoring for signs of dehydration and kidney function. Rationale: lithium therapy requires monitoring for signs of dehydration and changes in kidney function due to the potential nephrotoxic effects. Other assessments are relevant, but not the priority. 131. A nurse is caring for a patient with schizophrenia who is experiencing delusions. Which of the following is the most appropriate nursing intervention? A. Tell the patient that their delusions are false. B. Provide reassurance that their delusions will go away soon. C. Redirect the patient's focus to reality-based topics. D. Encourage the patient to talk about their delusions. Answer: C. Redirect the patient's focus to reality-based topics. Rationale: redirecting the patient's focus to reality-based topics helps keep the conversation grounded and prevents reinforcing the delusions. Agreeing with or focusing on the delusions can worsen the symptoms. 132. A nurse is caring for a patient who has a history of self-harm. Which of the following is a priority intervention for this patient? A. Assess the patient's risk for self-harm. B. Establish a no-suicide contract with the patient. C. Provide education about alternatives to self-harm. D. Allow the patient to have private time alone. Answer: A. Assess the patient's risk for self-harm. Rationale: the priority intervention for a patient with a history of self-harm is to assess their current risk. Once the risk is established, further interventions can be planned. 133. A nurse is caring for a patient with depression who is prescribed a tricyclic antidepressant, TCA. Which of the following side effects should the nurse monitor for? A. Tremors and rigidity. B. Orthostatic hypotension and dry mouth. C. Weight loss and insomnia. D. Hyperactivity and restlessness. Answer: B. Orthostatic hypotension and dry mouth. Rationale: TCAs are known to cause side effects such as orthostatic hypotension and dry mouth. They do not typically cause tremors, weight loss, or hyperactivity. 134. A nurse is caring for a patient diagnosed with panic disorder. The patient is expressing fear and anxiety about an upcoming public speaking event. Which of the following is the best intervention? A. Encourage the patient to avoid the event to prevent anxiety. B. Educate the patient about relaxation techniques and coping strategies. C. Administer a benzodiazepine to calm the patient. D. Ignore the patient's fears to help them confront the situation. Answer: B. Educate the patient about relaxation techniques and coping strategies. Rationale: teaching relaxation techniques and coping strategies helps the patient manage anxiety. Avoiding the event or administering medication may not address the underlying anxiety long-term. 135. A nurse is caring for a patient who has a history of substance abuse. The patient reports cravings and urges to use alcohol. Which of the following interventions is most appropriate? A. Provide a structured environment with limited stimulation. B. Focus on the patient's past successes in overcoming cravings. C. Encourage the patient to engage in substance use-related discussions. D. Redirect the patient's attention to a distracting activity. Answer: D. Redirect the patient's attention to a distracting activity. Rationale: redirecting the patient's attention to a different activity can help manage cravings and prevent relapse. Focusing on past successes or encouraging substance use-related discussions may not be helpful. 136. A nurse is caring for a patient who is newly diagnosed with obsessive-compulsive disorder, OCD. Which of the following is the most appropriate nursing intervention? A. Encourage the patient to engage in their compulsions to reduce anxiety. B. Focus on helping the patient reduce compulsive behaviors gradually. C. Challenge the patient's irrational thoughts directly. D. Ignore the compulsive behaviors and allow the patient to continue. Answer: B. Focus on helping the patient reduce compulsive behaviors gradually. Rationale: gradually reducing compulsive behaviors is an effective therapeutic approach for OCD. Encouraging or ignoring compulsions can reinforce the disorder, while challenging thoughts directly may be confrontational. 137. A nurse is caring for a patient with generalized anxiety disorder, GAD. Which of the following is the most appropriate nursing intervention? A. Teach the patient relaxation techniques, such as deep breathing. B. Encourage the patient to avoid stressful situations at all costs. C. Administer anti-anxiety medications as prescribed without any education. D. Focus solely on the patient's physical symptoms of anxiety. Answer. A. Teach the patient relaxation techniques, such as deep breathing. Rationale. Teaching relaxation techniques helps manage anxiety effectively. Avoiding stressful situations is not practical, and medication education and addressing both physical and psychological symptoms are essential for comprehensive care. 138. A nurse is caring for a patient who is experiencing a manic episode. Which of the following nursing interventions is most appropriate? A. Allow the patient to set their own treatment schedule. B. Set clear and consistent limits on behavior. C. Encourage the patient to participate in group therapy. D. Focus only on the patient's physical needs and ignore emotional concerns. Answer. B. Set clear and consistent limits on behavior. Rationale. During a manic episode, setting clear and consistent limits on behavior helps manage impulsivity and agitation. Flexibility in treatment or focusing solely on physical needs can lead to confusion and a lack of structure. 139. A nurse is caring for a patient who is diagnosed with bipolar disorder and is experiencing a depressive episode. Which of the following interventions is most appropriate? A. Encourage the patient to participate in high-energy activities. B. Establish a structured, consistent daily routine. C. Provide stimulating and distracting activities to reduce low mood. D. Focus solely on the patient's past successes and strengths. Answer. B. Establish a structured, consistent daily routine. Rationale. A structured, consistent routine helps provide stability for patients experiencing depression. High-energy activities or overly focusing on strengths may be overwhelming or unhelpful during depressive episodes. 140. A nurse is caring for a patient with a history of schizophrenia who is prescribed clozapine. Which of the following is the most important nursing consideration? A. Monitor the patient's blood glucose levels regularly. B. Monitor for signs of agranulocytosis and regular white blood cell counts. C. Educate the patient on the importance of daily exercise. D. Encourage the patient to increase dietary fiber intake. Answer. B. Monitor for signs of agranulocytosis and regular white blood cell counts. Rationale. Clozapine can cause agranulocytosis, a potentially life-threatening condition. Regular monitoring of white blood cell counts is essential to ensure the patient's safety. 141. A nurse is providing discharge teaching for a patient prescribed an antidepressant. Which of the following instructions should the nurse provide? A. It may take 4 to 6 weeks to experience the full effects of the medication. B. You can stop the medication as soon as you feel better. C. You should avoid all physical activity while taking the medication. D. You may stop the medication immediately if you experience any side effects. Answer. A. It may take 4 to 6 weeks to experience the full effects of the medication. Rationale. It often takes 4 to 6 weeks for antidepressants to reach their full therapeutic effect. The medication should not be stopped abruptly, and physical activity is not contraindicated unless otherwise directed. 142. A nurse is caring for a patient with dissociative amnesia. Which of the following is an appropriate nursing intervention? A. Encourage the patient to recall past traumatic events. B. Provide a safe environment and allow the patient time to process their feelings. C. Challenge the patient to remember their past. D. Focus only on the patient's present circumstances and avoid discussing the past. Answer. B. Provide a safe environment and allow the patient time to process their feelings. Rationale. A safe environment and time to process emotions are crucial for patients with dissociative amnesia. Encouraging recall of traumatic events or challenging the patient may worsen symptoms. 143. A nurse is caring for a patient diagnosed with anorexia nervosa. Which of the following interventions is most appropriate? A. Encourage the patient to participate in group therapy to improve social interactions. B. Monitor the patient's weight and dietary intake regularly. C. Allow the patient to set their own weight goals without intervention. D. Focus solely on the patient's appearance and weight fluctuations. Answer. B. Monitor the patient's weight and dietary intake regularly. Rationale. Monitoring weight and dietary intake is essential to ensure nutritional stability. Group therapy can be beneficial, but monitoring physical health is the priority in anorexia nervosa. 144. A nurse is caring for a patient with schizophrenia who is prescribed haloperidol. Which of the following should the nurse monitor for as a potential side effect? A. Sedation and hypotension. B. Muscle rigidity and tremors. C. Increased appetite and weight gain. D. Hyperactivity and impulsive behavior. Answer. B. Muscle rigidity and tremors. Rationale. Haloperidol, a typical antipsychotic, can cause extrapyramidal side effects such as muscle rigidity and tremors. It does not typically cause sedation, hypotension, or weight gain. 145. A nurse is caring for a patient with a history of substance use disorder who is participating in a rehabilitation program. Which of the following interventions is most appropriate? A. Encourage the patient to avoid all social situations to prevent relapse. B. Provide opportunities for the patient to share their experiences in group therapy. C. Limit the patient's interaction with family members to prevent triggers. D. Discourage the patient from discussing past substance use experiences. Answer. B. Provide opportunities for the patient to share their experiences in group therapy. Rationale. Group therapy provides a supportive environment for patients to share their experiences, build coping skills, and prevent relapse. Avoiding all social situations or limiting family interaction may increase isolation. 146. A nurse is assessing a patient for signs of mania. Which of the following behaviors would be most indicative of a manic episode? A. Low energy and excessive sleeping. B. Rapid speech and flight of ideas. C. Persistent feelings of sadness and hopelessness. D. Avoidance of social interactions. Answer. B. Rapid speech and flight of ideas. Rationale. Rapid speech and flight of ideas are hallmark signs of mania. Low energy, sadness, and social withdrawal are more indicative of depression. 147. A nurse is caring for a patient who is diagnosed with borderline personality disorder. Which of the following behaviors is characteristic of this disorder? A. Emotional stability and trustworthiness. B. Intense mood swings and unstable relationships. C. Strong fear of abandonment and isolation. D. Low self-esteem and lack of interest in relationships. Answer. B. Intense mood swings and unstable relationships. Rationale. Borderline personality disorder is characterized by unstable relationships and intense mood swings. Fear of abandonment and low self-esteem are also common, but the hallmark is emotional instability. 148. A nurse is caring for a patient diagnosed with post-traumatic stress disorder, PTSD. Which of the following is a common symptom of PTSD? A. Flashbacks and intrusive thoughts about the traumatic event. B. Lack of interest in social interactions. C. Difficulty focusing and remembering recent events. D. Hyperactivity and impulsivity. Answer. A. Flashbacks and intrusive thoughts about the traumatic event. Rationale. Flashbacks and intrusive thoughts are core symptoms of PTSD. Social withdrawal and difficulty concentrating are also common, but the hallmark symptom is the re-experiencing of the trauma. 149. A nurse is caring for a patient with depression who is taking fluoxetine, Prozac. Which of the following adverse effects should the nurse monitor for? A. Tremors and muscle rigidity. B. Suicidal thoughts, especially when first starting the medication. C. Weight gain and drowsiness. D. Sedation and hypotension. Answer. B. Suicidal thoughts, especially when first starting the medication. Rationale. SSRIs like fluoxetine are associated with an increased risk of suicidal thoughts, particularly when treatment is first initiated. Monitoring for mood changes is crucial. 150. A nurse is providing care to a patient diagnosed with antisocial personality disorder. Which of the following behaviors is characteristic of this disorder? A. Intense emotional reactions and impulsivity. B. Violating the rights of others without remorse. C. Fear of abandonment and unstable relationships. D. Overly cautious and avoidant behaviors. Answer: B. Violating the rights of others without remorse. Rationale: antisocial personality disorder is characterized by a disregard for the rights of others and lack of remorse for harmful behavior. Emotional instability and fear of abandonment are more characteristic of borderline personality disorder.